First off, I would like to discuss the top 5 indicators when comparing the healthcare systems. So the 5 most important evaluation points are the insurance mechanisms, the health outcomes, the quality of care, and the healthcare costs and the current threats. Together, these 5 will provide an overview of how both healthcare systems work and what determines how effective they are. An overview and history of the U.S. healthcare. The healthcare in the U.S. is comprised of public and private insurers, composed of nonprofit and profit organizations. Insurance is primarily provided by employers and makes up for the largest percentage of people who are insured. There are multiple public programs available, such as Medicaid, Medicare, and CHIP, which is the Children's Health Insurance Program. These are income-based, and several variables go into determining who qualifies for these programs, and these are funded via taxation. The Affordable Care Act of 2010 requires Americans to have health insurance. However, it's still not accessible to all people. This is income-based as well and looks at the family as a whole. With the changes of the Affordable Care Act, children can remain on a parent's plan now until the age of 26. And this opened up health insurance marketplaces, which offer subsidies to lower and middle income individuals, and it expanded the Medicaid eligibility. However, despite these facts, thousands of Americans still remain uninsured at a rate of 8.5% of the population. To review the history of the Irish healthcare system, they are comprised of public and private options which are available. So all residents are awarded the public healthcare just by being a resident, and this goes for immigrants as well. You just have to prove your intent to be a resident there for at least a year. If you are paying privately for health insurance, so you're not just using the public healthcare option, you have the ability to purchase additional healthcare, which include payments for high-tech hospitals, which are not included in the public healthcare scheme. These hospitals offer better technology, faster, wait times, and utilizing public hospitals is free to all, whether or not one possesses a medical card, which is the equivalent of the American version of Medicaid. And there is a long-term illness scheme available at a cost, and this will cover, pharmaceutical needs and medical procedures. But there are different tiers to the healthcare in this system. So you can opt to have the public system, which is, again, taken out of your paycheck, but then there are private options available to give you basically upgrades in your insurance package. So this is a comparison of the insurance mechanisms provided by the United States and Ireland. Both health insurance plans are covered by taxation. In the United States, funded by taxation to support Medicaid and Medicare. And it's comprised mostly of privatized health insurance options, which are offered by employers. However, we did speak about other options for receiving insurance. And Medicaid and Medicare are available to qualifying individuals, whether that be an age limit or an income variable. And they're also comprised of the Affordable Care Act of 2010, which has expanded the insurance marketplace. Ireland's healthcare is primarily funded by the government. Additional funding is provided by secondary privatized healthcare options through the household spending. This complex system is managed by the Health Service Executive and is largely financed by the Irish government. The public healthcare system is available to all long-term residents with the stipulation that in order to receive this healthcare, one must live in Ireland for a minimum of 1 year, so they have to prove their residency. And there's also availability of a medical card, which functions similarly to the Medicaid in the United States. And this system allows certain residents to have access to specific healthcare needs if unable to afford privatized insurance for specific needs. Ireland is considered to have one of the top healthcare systems in the world. The mortality rate for men and women is above average when compared to other countries. And in 2019, Ireland's gross domestic product spent on healthcare was 6.85, and we will get into further specifics for the United States in just a moment. So let's review the health outcomes in the United States. Since the institution of the Affordable Care Act, the U.S. has actually shown worse health outcomes with higher costs. The mortality rate per 1,000 people, according to the CDC, is 7.152. The birth rate is 11.6 per 1,000. The life expectancy is 77.8 years. And some of the top problems are that 6 out of 10 Americans suffer from at least one chronic disease, and 4 out of 10 Americans suffer from 2 or more chronic diseases such as heart disease, diabetes, cancer, chronic kidney disease, and chronic lung disease. When you're looking at Ireland's health outcomes, there are some better statistics. According to the World Bank data of 2021, the mortality rate in 2018 was 6.4 per 1,000 people. The birth rate in 2018 is 13.028 per 1,000. And 40% of Ireland's deaths in 2017 were a result of behavioral health risk factors, such as smoking, poor nutritional habits, and alcohol consumption. A bigger problem that Ireland has is that there is a large population that is considered obese, meaning that their BMI is over 20. 66% of men in Ireland are obese, which makes it the 10th most obese country in Europe. And cancer and circulatory related deaths are the top cause of death in Ireland. So there is some similarity there in comparison to the United States. So let's take a look at how the insurance mechanisms and the inner working of the government have affected the quality of care in the United States. So the United States spends 2 times more than the average OECD, which is the Organization for Economic Cooperation and Development. Yet it has the lowest life expectancy and highest suicide rates among 11 nations. The United States has the highest chronic disease burden, which is 2 times higher than the average OECD, and the obesity rates are also twice the average. Racial disparities also exist among African American women, which have high birth rate fatalities, and the highest number of hospitalizations from preventable causes, along with the highest rates of avoidable deaths. When looking at the Irish system of how the healthcare has affected their quality of care, Ireland remains the only European country in which primary care is not covered under the universal health system. And this causes an increase in expenditure for acute care because people are not receiving the primary care to help with the prevention aspect. And this also has increased wait times for specialists and elective surgeries, but it's kind of a societal norm in this country. And there are also known disparities between different cultures, ethnic makeup, religion, and socioeconomic disparities. So let's take a look at healthcare costs. In the United States, in 2018, the gross domestic product spent per person was 16.9%, which was the highest in the world. And when you look at Ireland in 2019, their GDP spent per person was 6.8%. So obviously a marked difference there in healthcare costs. But I think you see the offset when it comes to healthcare and wait times. In the United States, the per capita expenditure is over $10,000, which is an average of $1,122 that is due out of pocket due to private insurance premiums, and there are high demand for services and advanced use for technology services. Medicare in 2018 had spent $799.4 billion, and Medicaid expenditures were $613.5 billion in 2019. In private insurance expenditures, $1,195.1 billion in 2019. All of these things have increased by about 3% each year. And in Ireland, again, you take a look at the GDP spent per person, it was 6.8, and 30% of Irish residents actually qualify for the medical card, so their healthcare is entirely free. But that leaves the other 70% to pay privately. However, the costs are low due to taxation and if willing to utilize public hospitals. The multiple private plans that are available in Ireland range anywhere at the lowest, 16 euros each month up to 120 euros each month, which is the equivalent of $17 to 130 US dollars per month. In the US, you will see anywhere between $20 a week for a single person all the way up to hundreds of dollars a week or every 2 weeks based on a pay period that the U.S. is spending on healthcare. So let's take a look at the current threats to healthcare in both of these countries. So setting aside COVID at the moment, because that is the highest threat to healthcare anywhere, I think, at this moment. The top 5 threats to the U.S. healthcare are chronic disease, substance abuse, addiction, mental health, lack of vaccinations, and violence. These factors increase healthcare costs and expenditures by thousands of dollars each year and increase the morbidity and mortality rates. With the cost of the U.S. healthcare on the rise, the U.S. ranks 35th overall as one of the unhealthiest countries. And this is largely due to preventable disease processes attributed from behavioral factors such as poor nutrition, inability to seek healthcare treatment, poor vaccination rates for diseases such as HPV, which is on the rise and can cause certain cancers in men and women. Ireland's current threats to healthcare are more structural in nature. Due to the two-tiered system, there are extended wait periods for elective procedures, with adults waiting approximately 9 months for inpatient elective procedures, and children are waiting approximately 6 months. Hindering this is the increasing wait time is the lack of physicians, which according to the Department of Health in 2018 was 2.8 physicians for every 1,000 patients. This is low in comparison to several other countries. As a result of these factors, overcrowding in hospitals from ER to inpatient is leaving patients untreated in the hospital environment. So patients are sitting there for hours, sometimes days on end, waiting to receive care even in the emergency room. And the fallout to the structure is due to the Health Services Executive Board, inability to manage primary and acute care services. So this is really leading to overcrowding and delaying care, which is where Ireland struggles in chronic disease management. So there are some definite pros and cons to each healthcare system in the United States and Ireland. If you're looking at cost-wise, Ireland definitely has that part more manageable, more affordable for the community and their residents, whereas the U.S., it's an ever-increasing problem is the affordability and accessibility of the health insurance. However, when you look at preventative disease, the U.S. definitely, I would say, pales in comparison. When it comes to Ireland, the U.S. offers better services, less wait times. People can get right into their providers, whereas with Ireland, you have more of a sit and wait type of system. So there are definitely areas where both countries can improve. And I also think there are multiple places that each country could learn from the other to manage costs more effectively and help provide insurance to every resident. Everyone has the right to have health insurance. So there are definitely some pros and cons to both systems. I want to thank you guys for watching this presentation, and I really look forward to your feedback. Thank you.